Good morning, and welcome to Ethical Inquiries. Today, we delve into a deeply pertinent question within the field of mental health. Should psychotherapists be required to undergo therapy themselves? It's a topic that touches upon professional standards, therapist well-being, and ultimately, the quality of care patients receive. To explore this complex issue, we have two distinguished guests. Dr. Eleanor Vance, an experienced psychotherapist and clinical supervisor who argues in favor of mandatory therapy, and Dr. Ben Carter, a psychotherapist and academic researcher who will present arguments against such a mandate, proposing alternative approaches. We'll begin with opening statements, followed by a moderated discussion, and conclude with closing remarks from each of our guests. Dr. Vance, please begin.
Thank you, Sarah. I believe firmly that requiring psychotherapists to undergo their own therapy is not merely beneficial, but essential for competent and ethical practice. Our profession is built on the foundation of understanding the human psyche, and that understanding must begin with ourselves. How can we guide others through their emotional landscapes if we haven't navigated our own? Personal therapy provides an unparalleled opportunity for therapists to enhance their self-awareness. It allows us to identify and process our own biases, unresolved conflicts, and emotional triggers. Without this self-examination, these personal factors can unconsciously seep into the therapeutic relationship, potentially leading to countertransference that hinders or even harms the client. Furthermore, experiencing therapy from the client's chair offers invaluable insights. It cultivates a deeper empathy for what our clients go through, the vulnerability, the courage it takes to engage in the process, and the nuances of the therapeutic alliance. This experiential knowledge can significantly improve our clinical skills and our ability to connect with clients authentically. The work of a psychotherapist is incredibly demanding. We are regularly exposed to trauma, distress, and intense emotions. This makes us highly susceptible to compassion, fatigue, and burnout. Personal therapy acts as a crucial support system, a space where therapists can process these occupational hazards and maintain their own psychological well-being, ensuring they can continue to provide effective care. Finally, I see it as an ethical imperative. We have a duty of care to our clients, a responsibility to do no harm. A therapist who has not adequately explored their own psychological makeup, their own potential blind spots and vulnerabilities, is, I argue, not fully equipped to meet this ethical standard. Therefore, mandating personal therapy is a proactive step towards safeguarding clients and upholding the integrity of our profession.
Thank you, Sarah and Dr. Vance, for your points. While I wholeheartedly agree that personal therapy can be profoundly beneficial for therapists, and I would encourage it, I have significant reservations about making it a mandatory requirement. My primary concern revolves around therapist autonomy and the potential for unintended negative consequences. Mandating therapy, regardless of individual need or preference, can feel intrusive. It might also inadvertently foster a perception that therapists are inherently more flawed or unstable than other professionals, which could paradoxically increase stigma rather than reduce it. We must also consider the practicalities. There are significant logistical and financial barriers associated with ongoing therapy. For early career therapists, often burdened with student debt and lower starting salaries, the added cost and time commitment of mandated therapy could be prohibitive. This might even deter talented individuals from entering the profession altogether, particularly those from less privileged backgrounds. Then there's the question of effectiveness. Therapy is most powerful when it is sought voluntarily, driven by intrinsic motivation for self-discovery and growth. Can forced therapy truly yield the same benefits? There's a risk it could become a mere tick-box exercise, fulfilling a requirement without genuine engagement. The quality and type of therapy received would also need careful consideration. Who decides what is adequate? Lastly, it's important to acknowledge that the profession already has several safeguards in place to ensure therapist competence and well-being. Robust clinical supervision, peer consultation groups, and continuous professional development are standard requirements. These mechanisms are specifically designed to help therapists reflect on their practice, address personal challenges impacting their work, and maintain ethical standards. I believe strengthening these existing structures is a more appropriate and less problematic approach.
Thank you both for those compelling opening statements. Dr. Vance, Dr. Carter raises a pertinent point about autonomy and the potential for therapy to feel intrusive if mandated. How do you reconcile the mandatory aspect with a therapist's personal choice and professional autonomy?
That's a valid concern, Sarah, and one that the profession takes seriously. However, I believe that in professions where the well-being of vulnerable individuals is paramount, certain individual autonomies are reasonably curtailed to ensure public safety and trust. For example, surgeons are required to adhere to stringent hygiene protocols, pilots to rigorous flight simulations. These aren't seen as infringements on their autonomy, but as necessary measures to protect those they serve. In psychotherapy, our instrument is ourself. Ensuring that instrument is well-tuned and understood is, in my view, an ethical responsibility that can justify a mandate. Moreover, a mandate doesn't have to be rigidly prescriptive. We could explore models where the type of therapy or the frequency is flexible, tailored to individual needs within a broader framework of required personal therapeutic work. The core principle is ensuring some form of dedicated self-reflection with a trained professional.
Dr. Carter, Dr. Vance likens this to safety protocols in other professions. She argues that if a therapist hasn't explored their own issues, they may unintentionally harm clients. If not through mandatory therapy, how can the profession more robustly ensure therapists are adequately addressing their potential blind spots and emotional baggage that could impact client care?
I appreciate the analogy, but I believe the comparison isn't entirely direct, due to the deeply personal nature of psychotherapy itself. While I agree that unaddressed blind spots are a risk, I maintain that self-awareness can be cultivated effectively through multiple avenues. High-quality, intensive supervision, especially during formative training years and continuing throughout a career, is critical. This isn't just case discussion. It should explicitly include exploration of the therapist's reactions, countertransference, and personal factors influencing their work. Peer consultation groups, when structured and facilitated properly, also offer a confidential space for therapists to process difficult cases and their own responses. Furthermore, a commitment to lifelong learning and reflective practice should be ingrained in our professional culture. My concern with a mandate is that it risks a, quote, one-size-fits-all solution, and, as I mentioned, the potential for it to become a superficial compliance exercise rather than fostering genuine, deep-seated self-understanding, which is best driven by internal motivation.
Let's delve into those alternatives. Dr. Carter, you mentioned strengthening supervision and peer review. What specific enhancements would you propose to make these methods as effective as, or more effective than, mandatory personal therapy in addressing the core issues Dr. Vance has raised, such as burnout and unexamined biases?
Certainly. For supervision, I envision models that are more intensive and perhaps more specialized. This could involve supervisors receiving specific training in helping supervisees explore personal factors affecting their clinical work, moving beyond simple case management. We could also implement requirements for a certain number of supervision hours dedicated specifically to the therapist's personal reactions and well-being, documented and reviewed as part of professional standards. As for peer support, formalizing these networks could be beneficial. Perhaps professional bodies could facilitate or even mandate participation in accredited peer consultation groups that follow specific guidelines for reflective practice and mutual support, ensuring a consistent quality and focus. These approaches preserve autonomy while still fostering a culture of accountability and self-reflection, targeting the issues directly within the professional context.
Dr. Vance, if we were to consider a mandatory system, how do you envision it being implemented logistically? Who would oversee it? And how would concerns about cost and accessibility, particularly for those early in their careers or in underserved areas, be addressed?
Those are crucial practical questions. Implementation would require careful planning, likely phased in. One approach could be integrating it into licensing requirements, where proof of ongoing or periodic personal therapy is needed for renewal, much like continuing education credits. Professional bodies could play a significant role in accrediting therapists who provide these services to other therapists, ensuring quality and ethical oversight. They could also develop guidelines regarding frequency and duration. Regarding cost and accessibility, these are genuine barriers that must be addressed. I would advocate for subsidized schemes, perhaps funded through professional association fees, or even as part of employment benefits in larger institutions or healthcare systems. Group therapy, which can be more cost-effective, could also be considered as a valid component for some therapists. For those in remote areas, teletherapy could provide access. The investment, while significant, must be weighed against the long-term benefits. Improved client outcomes, reduced therapist burnout and turnover, and enhanced public trust in our profession. These are substantial returns.
In closing, while the intention behind advocating for mandatory therapy for psychotherapists is undoubtedly to enhance client care and therapist well-being, goals I fully share, I maintain that a mandate is not the most effective, equitable, or respectful path to achieving them. My concerns about infringing on professional autonomy, the significant financial and logistical hurdles, and the potential for therapy to become a superficial requirement rather than a deeply personal journey remain substantial. We must not underestimate the power and potential of our existing support structures. Rigorous and reflective clinical supervision, robust peer consultation, and a commitment to continuous professional development are cornerstones of ethical and effective practice. Strengthening these, making them more focused on personal reflection and therapist well-being, offers a more nuanced and less problematic approach. It fosters a culture of responsibility and self-awareness from within the profession, rather than imposing it from without. Ultimately, therapist well-being and professional competence are absolutely paramount. However, fostering these qualities is best achieved through a combination of robust support systems, individual responsibility, and a culture that encourages voluntary engagement with personal growth, including therapy, when an individual feels it is right for them.
To conclude, I want to reiterate that the call for mandatory therapy for psychotherapists stems from a deep commitment to our client safety and the ethical integrity of our profession. We ask our clients to be vulnerable, to explore their deepest selves. It is only right that we, as practitioners, undertake a similar journey. This first-hand experience enhances our empathy, refines our skills, and critically, helps us identify and manage our own issues so they do not compromise the therapeutic space. Preventing burnout is another key factor. Our work is demanding, and personal therapy provides essential support for sustainability. The argument is not that therapists are more flawed, but that the nature of our work requires an exceptional level of self-awareness and emotional resilience. While I acknowledge the logistical and financial challenges Dr. Carter has rightly pointed out, I believe these are surmountable with thoughtful planning, institutional support, and a collective will within the profession. The potential benefits far outweigh these difficulties. Requiring therapists to engage in their own therapy is, I believe, a vital and progressive step. It's an investment in ourselves, in our clients, and in the future credibility and effectiveness of psychotherapy as a healing discipline. It is about striving for the highest possible standard of care.
Thank you, Dr. Vance and Dr. Carter, for such an insightful and robust discussion on this important and often debated topic. You've both presented your arguments with clarity and conviction. We've heard compelling points on both sides. Dr. Vance emphasizing the ethical imperative, enhanced self-awareness, and burnout prevention through mandatory therapy, and Dr. Carter highlighting concerns about autonomy, practical barriers, and the efficacy of alternative supports like supervision. It's clear that this issue is complex, with valid arguments on all sides, and the conversation about how best to support therapists and protect clients is ongoing and vital for the field of psychotherapy. We encourage our listeners to reflect on the perspectives shared today. Thank you for joining us on Ethical Inquiries.